Hello and welcome to a video assessment. I'm going to do the last segment, which is the gastrointestinal, the genitourinary assessment of the patient. Um, and again, I'm going to perform. I'm trying to be creative here and perform a pseudo assessment or something close to it, because I'm not able to perform it on anybody else. So I'm going to use my pillow here as my patient, as the abdomen. This is going to be the abdomen of my patient, and I'm going to perform it as I would do on a patient. So first off, like I said, you will, um, knock the door, or get in the patient's room, close the door, provide privacy, um, introduce yourself to the patient, explain what's going to happen, what you're going to do, um, and then you're going to perform, your checks. You're going to check their name, date of birth, make sure you got the right patient. Um, and then something also that might be important or necessary is just kind of, go through a quick health history assessment if you haven't, or if you don't know. Ask of any changes in the bowel movement, any if they have any pain when they're eating, any ulcers, things like that. That's gonna just help you do your assessment, help you focus, do a assessment when you're doing your abdominal assessment. Um, and once you get all that questions done, and again, maybe I forgot to mention this. Also, remember to wash your hand. Once we get all that done, we get all the questions we needed. We are going to start with the patient, and the difference with abdominal assessment is the order. It's a different order, as you all know. You're gonna inspect the abdomen first of all, and obviously they have to have clothing off, their gown off, all that kind of stuff. You're gonna inspect, look for symmetry, look for any bulging, any. It should be like nice and symmetrical, nice and round. And of course, different patient will be, have a patient that maybe have ascites, it'll be rounded. But again, just look at it visually and inspect, and to give you a baseline if you're admitting patient. Once you inspect it, what you're going to do next is, we're going to auscultate. Um, and of course, you're going to put a stethoscope, and you're going to go. We're going to go in order. We're going to start on the right upper quadrant and go around back to the bottom. All right, going to get started. Listen, maybe 15-20 seconds. Listen again. Listen again. Listen again. And we should be listening for bowel sounds. Bobogme. Maybe there's no bowel sounds, and sometimes you count it. Of course, depending if you're doing a focus assessment or a full assessment, you count it, and you should have on each quadrant, 2 to 5. I can't remember the number quite right, but you should have at least a number of bowel sounds that you should hear. And of course, if the patient just ate, they're gonna be a lot more sounds than it depend on their meal. Around their meal, you can hear more sounds. If the patient just came back from surgery, you're not gonna hear no sounds, obviously because of anesthesia and all that stuff. All right, and once we're done with auscultation, what we're gonna do next is going to palpate. Palpation, we're going to do the same order. We're going to start from one quadrant and go around back to the bottom of the one to start with. On the palpation, you want to start light. You put hands, fingers, put light. You do light. You do light, and you do light. And it should be nice and soft. You shouldn't feel any tenderness. Just a nice and normal, regular abdomen. And of course, different patient will be different. And again, if you're doing an admission, that's going to be a baseline. Once you do the light assessment, and as you do that, you can ask the patient if they feel any pain. Is it tender? You're looking in some other conditions, like for example appendicitis, you can look for rebound tenderness. Push it down as you come back, they're gonna feel the pain. All right, and then once you do the light palpation, we're gonna do the deeper palpation. You can go a little bit deeper. Of course, if painful, you're gonna save that for last. But you're just gonna keep going around the same order we were going. Deeper palpations, deeper palpations. All right. Now that's another palpations. Um, and lastly, what you want to do is the percussion. That should be your last in the order of what we're doing. Just kind of palpate. I mean percuss. Sorry, percuss. Listen to that. Percuss. All right. Um, and that should be pretty much our assessment of the abdomen. The abdomen, as we listen, as we percuss, as we continue with the order we just went through. And just some things, like I said again, you want to save if it's tender, painful, save that for last. And I think that should be pretty much conclude the gastrointestinal side of our assessment. When it comes to genitourinary, um, you want to inspect. I cannot demonstrate this because I don't have anything to demonstrate with, but I'll just kind of talk through what you want to do when it comes to that. You want to inspect the perineal area. Um, you know, again, I am I am demonstrating this with the fact that we've done some health history assessment and we know at least what the patient told us subjectively, what they know. But then again, you're going to inspect, look for any, any irregularities. Again, for a male, you can inspect the penis. Um, you know, inspect for any, any sores, anything like that. For female, you're gonna inspect the vaginal, their vagina, the labia. You can inspect that, and then in between the perineal area, inspect that as well, and you can inspect the back as well. And it's kind of hard to really talk through it without explaining the meat and bones of the assessment of the genitourinary assessment, and really just ask some questions. They had any difference, bowel movements, any pain when they're urinating, you know, are there any UTIs recently? Those kind of questions really maybe will lead us in the right direction when it comes to genitourinary. All right, and that concludes my assessments today. Thank you so much. And again, I do apologize for the inconvenience. I really don't want to infect anybody, and that's why I'm just kind of choosing to do this. I hope this will suffice for the assessment. Thank you so much.